बर्नआउट, स्ट्रेस, ये सारी टर्मिनोलॉजीज हम हमारे आम कॉन्वर्सेशंस में यूज़ करते हैं। स्ट्रेस को हमेशा बहुत नेगेटिवली देखा जाता है, बट एक्चुअली दैट इज़ नॉट द केस।
Lifestyle has enhanced and many people have all sorts of advanced facilities. They are having good conveniences in lifestyle. Still, people are facing this mental challenges, emotional challenges. What might be the reason behind it?
So mental health is nothing new. It was predicted maybe more than 20 years back.
So what exactly is the difference between stress, anxiety, burnout and depression? So how important are healthy relationships for mental well-being? Is a clarity required for mature relationship?
Relationships are the most important thing. Isolation is one of the biggest causes of mental and physical health.
Hello and namaskar everyone. Welcome to today's episode. Let me begin with a simple question. When was the last time you paused and genuinely asked yourself, how am I doing? Not professionally, not financially, not socially, but mentally and emotionally. Today's conversation is not about mental illness. It is about mental wellness. It is about understanding ourselves better, building healthier relationships, finding emotional clarity, and learning how to live, not just function. And to help us navigate this important conversation, I am delighted to welcome someone who has spent more than 2 decades understanding the human mind and helping people navigate emotional challenges with greater awareness and balance. Joining us today is Dr. Malik, senior psychiatrist at Wockhardt Hospital, Central Mumbai. Through years of clinical practice and interaction with people across age groups and walks of life, he has helped individuals and families better understand themselves and build resilience in an increasingly demanding world. So let us begin our conversation. Welcome, Dr. Merchant.
Thank you.
Yes, it has been a pleasure to be with you. So mental health has been, a topic of discussion for quite some time in India, and it has been discussed in several platforms also. Now, what has changed? Since we see, lifestyle has enhanced and many people have all sorts of advanced facilities, they are having good conveniences in lifestyle. Still, people are facing this mental challenges, emotional challenges. What might be the reason behind it?
So mental health is nothing new. There is nothing new that is there. Uh, it was predicted maybe more than 20 years back that the rates of people who have mental health related problems is going to grow. If you see, the WHO had predicted that by 2020, mental health problems will be the number two problem after cardiovascular health. And exactly that happened. COVID struck, and everybody realized that mental health is a big, big problem. So, one is that awareness has increased. Second is that you always see that when awareness increases, the stigma goes down. So, as the awareness has grown, the stigma has gone down. So, the number of people who are approaching and coming up with mental health issues has also increased. Also, there has been an increase in number of people who have been suffering from mental illnesses. That has also happened if we see our pre-COVID numbers and post-COVID numbers. WHO has come out that there has been an increase of almost more than 25% of people suffering from just anxiety and depression. Lot of factors that are causing this rise also. And plus the awareness going up, the stigma coming down. That is why the mental health issues have come to a large forefront, and very rightly so. It was an unmet kind of attention that was not getting, mental health was not getting that kind of attention that it needed.
Right, right. So you just spoke about stress, anxiety, and depression. So what exactly is the difference between stress, anxiety, burnout, and depression?
ओके,
Yeah.
सो सम टर्मिनोलॉजीज हम अपने आम जिंदगी के गुफ्तगू में यूज़ करते हैं, और सम टर्मिनोलॉजीज हैं जो बहुत टेक्निकल है, जो डायग्नोस्टिक क्राइटेरिया में आते हैं। बर्नआउट, स्ट्रेस, ये सारी टर्मिनोलॉजीज हम हमारे आम कॉन्वर्सेशंस में यूज़ करते हैं। स्ट्रेस को हमेशा बहुत नेगेटिवली देखा जाता है, but actually that is not the case. Some amount of stress is very very productive. स्ट्रेस ही है जो हमको ड्राइव करता है टुवर्ड्स टेकिंग एक्शन। अदरवाइज अगर ज़ीरो स्ट्रेस है तो पर्सन कुछ करेगा ही नहीं अपने इश्यूज, अपने गोल्स, अपने ड्रीम्स अचीव करने के लिए। सो सम अमाउंट ऑफ स्ट्रेस इज गुड। व्हेन डज इट बिकम काउंटर प्रोडक्टिव? जब ये एक लिमिट से बाहर जब स्ट्रेस हो जाता है। इट्स अ बेल शेप्ड कर्व। थोड़ा स्ट्रेस अप टू अ सर्टेन लेवल मेक्स अस प्रोडक्टिव, मगर उसके बाद व्हेन इट passes the tipping point, it reduces productivity. So that is about stress. Burnout is when in life we have to learn that हमको बहुत सारे balls juggle करना है, 3, 4, 5, okay? जब भी one of them is our work, family, social life, friends, social responsibility, spiritual responsibility. जब भी हम सिर्फ एक ही बॉल जगल करते रहेंगे तो उससे बोर हो जाएंगे और बर्नआउट होगा। सो बर्नआउट इज व्हेन अ पर्सन gets too overwhelmed by their work life, their professional life, और उसके बाद में they get so fed up of it, they don't feel like doing things, और लोग उसमें usually they feel that burnout, productivity goes down and things like that. Depression and anxiety are clinical disorders, one of the most common mental illnesses. In fact, I would say one of the most common medical illnesses that one would come across. So these are some of the differences between these terms that you just mentioned.
I think we should touch this topic, which is most prevailing as of now. And we see emotional clarity is very important in terms of relationship. And so, how important are healthy relationships? And for mental well-being, is a clarity required for mental health and mature relationship? Or how would you define this concept of relationships in terms of enriching mental health as of now?
A very, very important and relevant topic that you're bringing up. Relationships are the most important thing.
Yeah.
Isolation is one of the biggest causes of mental and physical health. If you see the data, isolation is today the number one cause, one of the number one causes of mental health related problems. If you have healthy relationships, it is not just with your partner, with your friends, with your colleagues, with society in general, then you don't feel that isolation, and that protects you from developing mental health issues. And one of the reasons that firstly, we said that there's a rise in mental health problems.
Right.
The joint family, the traditional joint family structure
Right.
that was there earlier has crumbled. We all grew up with 4 uncles, 4 aunts, 15 cousins. Today, our children are growing up as a single child in a home where parents are working. So, relationships are very, very, very important, and it gives a lot of protection from developing mental health problems.
So we speak of a term called clarity.
Yeah.
So what does it exactly means, and how does it impacts any relationship? I think youth might be coming to you and asking advice. So how you have experienced about this thing?
I look at it from a little different angle.
Yeah.
I always tell people relationships are like your car. If you're not going to invest in it, if you're not going to maintain it,
Right.
it is going to wither away. So you have to have that clarity that relationships just don't work on its own. If you will not service your car, if you will not invest in your car, it is going to deteriorate very fast. Similarly, one has to have a clarity that मेरा relationship है, उसके अंदर मुझे time, effort, invest करना है. I need to be flexible. I cannot say that I'll be in a relationship, but I'll be rigid.
Right.
I cannot say that I will always put myself before
Right.
the other person. One has to have that flexibility. One has to develop that empathy
Right.
for your partner. There has to be communication that has to be there. There has to be time and emotional availability that has to be there. That is what I would call as mental clarity when you're entering into the relationships.
Yeah.
If you are just going to think about yourself always, then it is very difficult to sustain a relationship.
Exactly. And I think there is a very thin line between attachment, affection, and compatibility, because people are confused in terms of whether they are affectionate or whether they are compatible. So I think this has to be very much clarified in terms of understanding what exactly is the boundary which has to be set.
Absolutely. I always tell young people it is very easy to sit in Starbucks and hold somebody's hand and say, I love you, but it is difficult to live with that person for the next 25, 30, 40, 50 years.
Right.
So one has to have that amount of maturity to be able to sustain this long term relationship. Of course, it takes a toll. If you are emotionally attached to somebody, you cannot expect that tomorrow you're going to be out of it. It takes a little time for a person to deal with the vacuum that has been created
Right.
from a heartbreak. Okay, generally people feel कि ये relationship fail हो गया, that means मेरा end of life है, अभी मुझे कुछ नहीं होगा आगे, and then that despondency sets in, and sometimes then people resort to either harming themselves or using substances. Our
Yeah.
our media has popularized Devdas so much that that people, when they go to heartbreak, one of the main reasons that people give that they're using these substances is because they had a breakup or something. Very unhealthy way of
Yeah.
very unhealthy way of coping with anything like this.
And people are stuck on that also.
Yes.
I think, life is very, very beautiful. And I think one should respect time. They should understand the clarity. इस पे ना मुझे एक सुदर्शन फाकिर थे शायर, उनका एक बहुत अच्छा शेर मुझे इस समय याद आ रहा है आपसे बात करते हुए। न मोहब्बत न दोस्ती के लिए, न मोहब्बत न दोस्ती के लिए, वक्त रुकता नहीं किसी के लिए, अपने दिल को न दुख थे यूं ही इस ज़माने की बेरुखी के लिए, वक्त के साथ साथ चलता रहे यही बेहतर है आदमी के लिए।
क्या बात है।
तो ये मुझे याद आया अभी आपसे बात करी, तो आई थिंक ये this is a very important fact in life also. Life is beautiful and you should respect time. Otherwise, people go into depression when time is lost. And so I think this is just a dilemma. And I think this mental well-being comes with a social, I think, ecosystem as well.
Absolutely.
I think some training or some, obviously, you as a psychiatrist, you know how it is. But I think there should be more channels where people get uh, acquainted with all such types of knowledge and guidance also.
Absolutely.
Yeah.
Absolutely. One needs to invest
Right.
in our children and future generation
Right.
to be able to understand this emotional health much better so that they can navigate through life and its challenges, which is going to come in everybody's lives.
We talked about relationships. Mostly, people are working on hard career goals and they try to attain something they want to achieve in life. And there is a family pressure on young generation. Also, they are not aware about their limits, what they can achieve, what they cannot. And sometimes there are successes, sometimes there are failures in life. It is a part and parcel of life.
Absolutely.
So if somebody is not acquainted with this type of environment in a family, how would you address the ecosystem of the family? How they can manage such things, such adversities? Because the children, the young people, uh, their career are obviously they are at stake of losing something. So what is a message for such families? How they can address the issue?
So I always tell youngsters, there are going to be expectations.
Right.
हर पेरेंट को चाहिए कि मेरा बच्चा सलमान खान के जैसा दिखे, क्रिकेट तेंदुलकर के जैसा खेले,
Correct.
इंटेलिजेंट कलाम की तरह हो और पैसे एलॉन मस्क की तरह कमाए. These are the expectations of the families. And sometimes what happens is that this parental expectation, when they have too much of expectation from their children, that breaks the children. And that is what I advise to parents and to children, that don't come under so much pressure. You need to work hard, you need to do your best, but everybody is not going to achieve that kind of a success. So just putting your pressure on children, because there are so many avenues today children come, डॉक्टर बनना है, 25 लाख लोग नीट देते हैं, फिर रीनीट भी देते हैं. करेक्ट. और उसमें से सिर्फ 1 लाख लोगों को सीट मिलती. दैट डजंट मीन दैट 24 lakhs आर यूजलेस पीपल. देयर आर मेनी अदर ऑप्शंस इन लाइफ. आज जिंदगी बहुत चेंज हो चुकी है. एंड पेरेंट्स को भी यही समझना है कि हमको हमारे बच्चों का एक पोटेंशियल, वी नीड टू हेल्प देम find their interest areas and fulfill their potential. Too much of pressure putting on children is not fair.
Children are also, going in coaching classes and they also are meeting people, their colleagues and all. So what practical habits they should inculcate
Everybody has a passion,
Yeah.
okay, for something, a flair for something. I think one needs to follow that. Generally, we at times become a copycat society. Somebody in uncle's son has become a doctor, so I also want to be a doctor. uh, Cousin has becoming a CA, so I also want to be a CA, without thinking that am I cut out to be a CA? Am I cut out to be a doctor?
Right.
Those kinds of questions one needs to ask. One needs to go and meet these people who are practicing medicine or practicing as a CA or a lawyer and things like that, and try to find their own passion and not just blindly follow what their parents are saying, or not just do things because somebody else is doing. A lot of people in our society just blindly, सब लोग ये एग्जाम दे रहे तो मुझे भी देना है, that kind of a thing. And then they realize that maybe I'm not cut out for this kind of profession, or this kind of career path that I am seeking. So one needs to find out why they are getting into these careers.
How can parents identify emotional instability in their child? How how they can identify whether their child is going into distress?
There are a lot of red flags. There are a lot of red flags. But for that, parents need to spend time with their children. They need to invest some time into their children. Some of the most prominent red flags are when you are seeing that there has been a sudden change in your child's behavior. A child who was talkative, who was interactive, suddenly becomes withdrawn. You know, a child who was calm in most of the situations suddenly becomes very, very irritable. Suddenly you're seeing that the grades of the child are coming down. The child is not socializing as much as he was before. The child is not sharing as much as he was sharing before. These are subtle but very, very important signs. The child's screen time has gone up tremendously. Is losing interest in most of the activities. There are complaints of him becoming very irritable, aggressive in school with peers. These are very, very subtle signs, but if they are picked up early, somebody can at least speak to the child, "Okay, what is happening to you?" Right.
We spoke about career opportunities for youth and their plans for future and mental health and everything. Many of them achieve goals in their life. They become professionals. Some of them become leaders also. Now, obviously, when we see in the corporate houses, in our corporate sector, we see there is always a tussle between the ambition and the goals and mental wellness amongst the leaders.
Yeah.
So, how would you address that ecosystem which is prevailing as of now? Very it is a top ecosystem which is there, and I think it is leading to more of mental havoc. I'm using this word,
Totally.
but the ecosystem is being disrupted and tremendously, maybe due to pressure, due to targets, due to blah blah, so many things. So, what is the remedy out of it?
So I think more than individuals, as a society, we also need to step back. Even these corporates need to step back and think, okay, what are we trying to do? Are we trying to extract the last drop of blood from our employees just so that our balance sheets show better and better results? Or are we actually providing an ecosystem and environment where there is work-life balance also? It's a very unfortunate thing that people who are into these kinds of corporates sometimes become victims of the systems developed by the corporate, and then they are helpless. So we see this so many times, that burnout is actually not because of the incapability of the executive working over there. The work culture,
Right.
the corporate culture is such that is not very conducive for mental health
Hmm.
in such environments. So as a society, as a company, every one of them needs to think, because it is an investment for them also. It will increase the productivity of the employee. It will increase the productivity of the company if these things are better managed. Where work life balance is there. There is a environment where the employee can come and talk about their emotional health also. So those kinds of environments needs to be built into the system for people to have better mental health. Well,
So, can ambition and emotional wellness coexist?
I think it can. Why can't it? Okay. Being ambitious is one of the ingredients of of being mentally resilient also. If people are not ambitious, then there's nothing much to look forward in life, of course one can, these things can go hand in hand and should go hand in hand. One needs to achieve a higher goal after achieving one goal and things like that to move on in life. Otherwise, human race itself would have been stagnant.
Right. How leaders can create emotionally contained environment in the office? How they can create an environment which is emotionally fine tuned? Obviously, there are pressures,
Yeah.
but then how they can manage people? Are there any tips from your side? Have you worked on certain projects or certain advices, guidance for certain corporates where leaders inculcate an environment where they can address the issues? Obviously, day-to-day activities are there, but they can nurture an environment which is emotionally viable.
I think the most important thing is that when the environment is such that one can express themselves freely without any pressures or without being reprimanded for expressing their concerns, for expressing what they are not able to do, you know that is the first thing that one needs to look into. That is your team you know being there in an environment कि वो आके बोल सकते हैं कि सर ये मुझे समझ में नहीं आ रहा है, या तो ये आप जो टारगेट दे रहे हैं अनरियलिस्टिक है, या ये जो हम आप कर रहे हैं. एंड देन द लीडर्स नीड टू अंडरस्टैंड, एटलीस्ट सिट एंड talk to them and try to understand from them what are their problems, what are the issues they are facing. Nobody is a kamchor. Everybody wants that, where I'm working, that company should grow, we should grow with the company. That is the mentality that person comes to work with.
Right.
But we also need to understand that we also need to hear them out. As leaders, we need to develop an attitude, at least let me hear this person out. So that environment, if it is created in a team,
Right.
where they can at least express what they feel, what their problems are, and they are heard, not just brushed under the carpet. That is one of the most important ingredients, I think, to build a better emotional health environment in the company.
Maintaining work-life balance, maintaining families, giving time to families. I think it has become very hard in today's current life, and obviously with restricted timelines and everything. So how this anomaly can be addressed?
I always talk about quality of time, not quantity of time. Quality of time has deteriorated because of the devices that we have, weapons of mass distraction that are there in all our pockets.
Right.
You go for a dinner, the family of three, four, five come for a dinner to a very expensive restaurant, and the only time that the device is out of their hands is when they are eating. Otherwise, everybody is on their devices. Oh, we spend time with each other, but how do you spend time with each other? Looking at your own devices when you are sitting around with your family
Right.
is not definitely not quality time. So we need to understand that today's generation, we cannot spend long number of hours with our families because of the work pressure and whatever
Right.
what we are going through, but at least some quality time needs to be given to the families. Yeah, so I always tell them, put the phones down when you are with your family, at least for some time, and give undivided attention. So we have to focus on quality time rather than quantity time with our families.
Very well said, sir. The most important factor here would be that who would educate, who would create an ecosystem. As of now, people understand, people know all these things. Maybe I think there are so many workshops. Every corporate conducts so many workshops in their offices, premises, and there are so many things which are happening. But how they are incorporated, how they are utilized, nobody knows. And we see there are so many issues which are coming up in the family, in the personal life, and all. And people when get retired after that, they always face certain challenges.
So yeah.
Right. So if we speak of the elderly people, so I think elderly mental health is very under discussed. People don't discuss much about it. So what is your experience about it?
Very rightly said that the elderly mental health is one of the most neglected areas. And I was just talking to my students that, there are studies, and this we've seen in our practice also. The rates of suicide first peak in the young adults, and the second peak of the number of suicides that happens is in elderly people, and that everybody neglects. That everybody neglects. Elderly age is an age where one has to deal with their physical health, their isolation, and a lot of other factors, sometimes financial dependence. So there are a lot of factors. That is one of the most neglected area. Plus an age where cognitive decline is also started happening. So one needs to really pay attention to mental health of the elderly also, and needs to invest time and energy into dealing with their issues also.
So does retirement affects this sort of scenario?
Definitely it does. Definitely it does. Especially when the person is not planned or thought about what is the person going to do after retirement. 60, 62. I don't know what is the retirement age today. I don't know. Government is 58, 60,
60 years.
60 years of age. 60 years of age is not a geriatric age today.
Right.
Today, people live on to 80s and 90s also, in a relatively healthy state. So, what are you going to do for the next 10, 15, 20 years of your life? One needs to think before retirement and plan. If it is not done that way, it hits a person very, very hard. We've seen so many people who are not alcoholics but become alcoholics after they have retired. Nothing to do, sit and drink,
Right.
developing depression, meaning of life, what is my life worth of now? These questions start cropping up after retirement. So we always tell people, start thinking about what are you going to do after your retirement, after you retire at around 60. Many numbers yet, many years left to live, in today's time. So it hits people, especially if they've not been prepared for their retirement.
And how can families help reduce loneliness in such cases in terms of, improving the mental health of the senior members of the family? What should be their role?
Inclusion, definitely inclusion. You need to include the elderly people into your day to day life routines. If you're going to exclude them, they're going to wither away mentally, physically,
Right.
both. So including them into their family activities, into their family conversations, into decision making is very, very, very important for their self esteem, for their mental health, for their sense of belongingness. If this sense of belongingness is not going to happen, then definitely the senior citizens are do face a lot of emotional and mental health issues. It is a responsibility of
Right.
the youngsters to include their elders into their lives. That is very, very important. One needs to go back home and tell his dad that, how was his day, what were the challenges that he faced, and the dad will be most happy to hear him out. Nobody else will be.
See, many people are working away from their hometown and they are going outside and they I think many people come to their hometowns rarely during festivities or something. Now parents are alone. Nobody is taking care of them. So how they can manage in such a circumstance? What should be done in order to address the situation? Parents often come into depression. We have seen lot many cases where people die at
Yeah.
home. The children are not aware about it. People are working abroad. Parents are here. They are talking on phone. Daily they are connecting with each other. They get indulged in their personal lives. Parents also sometimes they get indulged in their personal lives. They have a different ecosystem. They create a different ecosystem around themselves also. Now there has to be there is always a gap,
Yeah.
a communication gap you can say, a generation gap you can say, and this is becoming very much irrelevant as of now because it is creating a lot of instances where proper care to elderly people is not being provided by any sort of measures, and this is a gap. How we can resolve this issue, which is I think which is progressing, and India being a developing country, in America, in other developed countries, we are seeing this thing happening, and this is I think most commonly occurring nowadays in India also.
Yeah.
It is progressive. So what could be the challenge in the coming future and how can it be addressed as of now, so that something, some fruitful resolution out of it can be availed?
I think it's a mindset of a person, even if the person is staying away from the family in a different town or in a different country.
Right.
Today, connecting to anybody costs zero money through our mobile phones and things like that. So I think keeping that connection going, even if it is a long distance thing, is a very, very, very important thing, And every day, 5 minutes, 2 minutes phone call to the mother or the father makes a lot of a difference, lot of a difference. Just being involved in their lives for small, small things makes a lot of a difference. That mindset the person needs to have, or the family staying away from the parents need to have, that I need to maintain that connection. It is not just the festivals or the vacation where I will go there and just connect to them. Yeah, रोजी रोटी के लिए सबको जाना पड़ता है यहाँ वहाँ, लेकिन at least that connection needs to be maintained between families.
Right.
So that is a very, very important thing. If one has a mindset that I have a parent back home and I am responsible for maintaining that connection, तो ही वो बन पाता है. Otherwise, life is very such a way that one would get distracted into a lot of other things and forget about their parents also.
So what exactly you see in future? A complete, you know, combination, consolidation of every type of, you know, uh, you can say resolution out of the mental health issue. What exactly you can see?
So sensitization is the most important thing to begin with.
Right.
I think sensitizing people about, their loved ones' needs is very, very important. Today, as you said, life is very fast paced. Some people don't even realize that, I have not called my or visited my parent for the last 1 month or 2 months or things like that. Sensitization about how important it is from their point of view also,
Right.
and how it will be detrimental. And also, today's generation understands economics better than any one of us. So also let them know that your visits, your concern will help them to live a physically healthy life also, so that you don't spend too much on their health issues, because isolation again will cause physical problems and mental problems.
Right. There is a rapid fire round, and just one or two words would be required
Okay.
as per your experience, what you feel about it. So I'll go with the first one. Mental wellness in one word. What you feel?
Most essential.
Okay. Happiness or success?
Happiness.
Right. Sleep or exercise?
Sleep.
Okay. Social media helpful or harmful?
No comments.
Okay. Why so?
Some ways it could be helpful also.
Okay.
Mm.
One relationship habit people should stop.
Criticizing.
Oh, great. And one thing parents should do more often.
Spend more time with children.
Okay. One thing children should do more for elderly parents.
Spend more time with them.
One habit every young person should build.
Invest in emotional health.
One habit every working professional should build.
Balance work and life.
And one myth about psychiatry.
People who go to psychiatrists are mad.
One daily practice for emotional clarity.
Meditation.
One message for families.
Spend time together.
And one message for someone who's silently struggling.
Reach out for help. Don't suffer in silence.
Great. So I think we have covered most of the things. One last piece of advice you would like to give to all the audience who are seeing this.
One thing is that mind and body are connected, they are not separate. If you are not investing in your mental health, you are going to develop problems in future. So prioritize. Mental health is essential for your overall well-being.
Thank you, Dr. Machin, for your valuable insights. And I think a lot many advancements are required. Repetitive conversations are required in order to address such issues. Thanks a lot. A special thanks to Livelong 365 and Wokard Hospital for organizing this podcast and creating a platform to talk about something that truly matters. As we sign off, until next time, Take good care of your health and mind as much as you take care of your goals. Stay healthy, stay mindful, and take care. Thank you and namaskar.